everyone, Nursing to Nurture here. Let's briefly go over some prominent signs and symptoms of HIV, human immunodeficiency virus. When HIV is first acquired, most people develop acute retroviral syndrome, which is often mistaken for the flu. During this time, the individual may develop a fever, swollen and tender lymph nodes, pharyngitis, a rash. The person may experience muscle and joint pain, headaches, nausea, vomiting, and diarrhea. There may also be weight loss, enlargement of the liver and spleen. The individual may begin to experience changes in vision, cognition, and motor function. Though the virus is rapidly replicating during this time, the antibody tests still may not be able to detect the HIV. Since HIV weakens the immune system, these patients are susceptible to opportunistic infections. They also tend to develop a form of cancer that is rare for their age and health history. One example of this is Kaposi sarcoma. This is a type of connective tissue cancer that is common in AIDS patients. The person with HIV could also acquire pneumocystis pneumonia. This is manifested by shortness of breath and a non-productive cough. Women that have been infected with HIV may also experience other problems such as pelvic inflammatory disease, genital warts, persistent vaginitis, and may also have abnormal pap smear results. Remember to use standard precautions when caring for patients with HIV, and remember that the H in HIV does not stand for humiliate. These patients still deserve dignity and respect. Alright everyone, that brings this video to an end. Please be sure to like, comment, share, and subscribe. Feel free to visit nursingtonurture.com for promo codes, merch, as well as more educational content. Remember to never give up, and as always, thanks for watching.